What do you think you're doing? Don't you know what that can do to you?
I only wanted to try it.
Don't you know about lung cancer?
What is one cigarette going to do to give me lung cancer?
Come with me.
This is what happens to your lungs when you get lung cancer. Smoking is one of the many factors that can make your genes mutate into deadly cancer cells.
Gene mutation? How do genes cause cancer?
Well, exposure to carcinogens can make your genes mutate into deadly cancer cells. Pro-oncogenes that regulate cell division and DNA repair can be mutated into cancerous cells. These cells will not repair DNA and will continue to divide until they create a tumor.
Oh, okay, so genes are mutated so they can't stop cell division and they create tumors.
Right.
Well, what are the symptoms for lung cancer?
Well, there's a lot of different kinds, some found in the most common cases. Symptoms that appear in the earlier stages are chest pains, a cough that doesn't go away, coughing up blood, fatigue or losing weight, shortness of breath or wheezing, but in some cases there may be no symptoms at all, making the cancer harder to treat. In some of the later stages, other symptoms appear. Some of the symptoms found in the later stages can include bone pain or tenderness, eyelid drooping, hoarse voice, joint pain, weak nails, shoulder pain, difficulty swallowing, swelling of the face, or weakness.
I know there's no cure for cancer yet, but there must be some form of treatment to help relieve these symptoms.
Well, there are some kind of treatments like chemotherapy, radiation, or certain types of surgery, but it depends on what type of lung cancer the patient has.
You mean there's more than one type?
There are two main types of lung cancer, small cell and non-small cell. Small cell lung cancer is less common. Approximately 15% of cases of lung cancer is small cell. It tends to be more aggressive, grow quickly, and spread rapidly, but often responds well to chemotherapy. Many people suffer from small cell lung cancer stage 4 because of their smoking habit. Small cell can be limited, controversial, or extensive, leaving about 60 to 70% of patients with the extensive disease. However, there are many different types of non-small cell cancer. Squamous cell carcinoma, or epidermoid carcinoma, is cancer that begins in the squamous cells, which are thin, flat cells that resemble fish scales. Large cell carcinoma is cancer that may begin in several types of large cells. Adenocarcinoma, the most common form, is cancer that begins in the cells that line the alveoli and make substances like mucus. A few of the many ways to treat these types include an X-ray or CAT scan. Or the patient can get sputum cytology, which is a procedure where a pathologist views a sample of sputum or mucus under a microscope to check for cancer cells. Fine needle aspiration biopsy of the lung is a way of treatment that removes tissue or fluid from the lung using a thin needle. A CAT scan is used to locate the abnormal tissue or fluid in the lung. A bronchoscopy is a procedure to look inside the trachea for abnormal areas. A bronchoscope is inserted through the nose or mouth into the trachea and lungs.
There's so many treatments. What could I expect if I got this?
Many factors affect prognosis, like the location, stage the cancer is in, and the age, health, and response of treatment of the patient. When the cancer is still located in the lung, the survival rate goes up 52.6%. However, early lung cancer is only detected about 15% of the time. 5-year survival rate for lung cancer is 15.6%, lower than other leading cancers. Over half of the people with lung cancer die within 1 year of being diagnosed. Even though these are scary statistics, there are ways to prevent lung cancer. There are some ways to prevent lung cancer from developing, such as avoiding risk factors like smoking, secondhand smoke, asbestos, radon, and air pollution. Do not start smoking. If you do, try to quit as soon as possible. A family history of lung cancer might make you more susceptible to gene mutation and eventually cancer cells. If so, make sure to make appointments and physicals with your doctor at least once a year.
So what does it mean about smoking?
I'm never going to do it again.
Good.
Some of the most common symptoms are in the later stages. Other symptoms appear.
Gene mutation? How do your genes cause cancer?
Exposure to carcinogens can make your genes mutate. No.